Our treatment model at the Attachment and Trauma Treatment Center for Healing Niagara is based on a triphasic model. So we look at phase one, which would be our safety, education, stabilization, and symptom reduction. Phase two would be more of that trauma processing and reappraisal work. And then phase three would be more of the consolidation of gains and transitioning to community. So these are not mutually exclusive, but rather more so our primary area of focus. Where we're a little bit different than some other treatment centers is that we do introduce the phase one work, absolutely, but we get into treating the underlying issues, working with the fire a little bit more quickly. And we do this for a couple of reasons. So, one would be quite often, the clients that we work with have many experiences happening in their lives, many daily experiences, traumas, stressors, and we could just treat what's coming up. But when we do that, we're just clearing up a little bit of space in their nervous system. What we really want to focus on is what's taking up the most amount of energy, space, activation for them. Quite often, that's what is coming up in their intrusions, right? In re-experiencing bad dreams, nightmares. And we want to work through that in a safe, structured way. And when we work on some of those bigger issues that are kind of running in the background, they often are amplifying the day-to-day stuff. So it might not be the stuff that's drawing our attention right now consciously, but a lot of times they work as amplifiers where in the background I have these early childhood experiences, these early templates, and essentially what these are neural networks of association that when something happens in the present, it's reinforcing that pattern for my brain, my body, my nervous system that says, yeah, this is just like this experience and this experience and this experience. And there's all of this reinforcement that's happening. Um, Yet, you know, the treating what's happening right now may help with what's happening now, but it's not necessarily going to have the biggest impact it could, right? So the next time something like that happens, we're going to again have that amplified response because that's what the body has learned. This is what we do in this moment, or the brain has learned this is what we do in this moment. So we do get in there and treat the trauma in a safe, structured way. I'll talk about our model in just a little bit here. And then after we've gotten through the bulk of the processing work, that's when we're really focusing on who are you as a person, right? The people that we're working with, who are they? What are their skills? What are their likes? What do they enjoy? Oftentimes, when we're experiencing trauma and we're flipping that lid, we're in this state of like treading water where people are just trying to survive. So, having a sense of who I am, what I like, what I do for fun is often not available to me because that's not where I'm living. I'm just trying to survive, right? This day, this moment, this second. And what we're doing when we've cleared out some of that trauma is starting to shift into some of the future forward thinking.